I am Dr. Sharjil and you are watching my YouTube channel. Today in this second video of Sayan dystopometer, I would like to give you a practical demonstration on patient, how to use it. First, bring it out of the box and check whether both vertical arms of dystopometer are moving freely or not. If they are moving freely, it means it is ready to use. And then you should place it like this on the patient nose bridge, and you can check variety of conditions like ptosis, proptosis, entropion, ectropion, squint, anisocoria. Now here I am checking the interpupillary distance, marginal reflex distance, upper lid crease, pretarsal show, and it's a patient of ptosis. And now by holding the frontalis, I am checking the levator function in the left eye. So the patient have got good levator function. And now it can also measure axial proptosis by holding the vertical arm horizontal, palpate the left lateral orbital rim with finger, put vertical scale there and measure up to corneal apex. Now then come to the other eye and note down any asymmetry or not. Asymmetry of 2 or more millimeters is abnormal. So you can measure dystopia, horizontal lid laxity as well as anisocoria or pupillary size with it. I would like to suggest the inventors that for pupil size they can make circles of varying sizes in vertical scale that will ease the measurement of anisocoria and pupil. Now this invention is instantly liked by ophthalmology fraternity, and that's why for doorstep delivery WhatsApp number is shared at the left bottom. Contact on that number and enjoy Sayan dystopometer within few days. Thank you.